Well, for many couples, having a baby requires unconventional methods. IVF, or in vitro fertilization, is used to treat infertility after more conventional methods have failed.
The Assisted Fertility Program's main infertility clinic office, located in Jacksonville, was the first fertility reproductive endocrinology program established in 1985. In addition to IVF, the facility also features a highly successful donor egg program. Dr. Marwan Shaykh is the program director, and he is a widely recognized pioneer in the field of reproductive medicine. He's here to tell us all about the different options that you have and the many others that are offered by the Assisted Fertility Program. Dr. Shaykh, thank you so much for being with us.
Thank you.
For those that are at home and are having difficulties right now, what is it that you guys do? Just break it down for us.
Well, by definition, infertility is when a couple is trying to achieve a pregnancy for a year or more and nothing is happening. Then this is when we counsel them and talk to them about what's available for them.
And you're the first doctor in North Florida to perform in vitro fertilization. How long have you been doing this, and what's changed along the way in the technology?
Well, we started doing in vitro fertilization in 1985. As a matter of fact, the first baby we had with in vitro fertilization is now 26 years old.
Oh, wow.
In vitro fertilization in 1985 was really considered the dawn of that field, and it has changed a lot, and there's a lot of things we offer now, from things like ICSI, which is treatment for male infertility, to egg freezing, to many, many other facets that helps us treat the infertile couple.
Now, aside from you obviously being a pioneer here, you were the first in North Florida. What sets you apart and your practice apart from others that are now springing up in the area?
Well, since I started in '85, my philosophy of treating patients was to make myself available as much as possible to patients, because patients going through infertility have a lot of financial and emotional burdens. So one of the things these patients really need is somebody to answer their questions, a physician rather than a nurse. And so I try to make myself available as much as possible to patients going through the treatment.
Very important.
And financially speaking, what does this typically cost, IVF?
IVF, we tried to, it used to cost almost $10,000. And because of the economy the way it is and the times, we cut it down to $6,000. As a matter of fact, we have a special type of in vitro fertilization called mini stimulation in vitro fertilization, where we give very little medicine, and that's cut down on the cost of in vitro and the cost of the medication, and helps the patients a lot.
So if there's a family out there right now that's watching this and they're having difficulty conceiving, what would you recommend to them? What are the first steps that they should take?
Well, my main advice is mainly the age of the female is going to be one of the most important things we look at. If you are 31, 32 or over in age, obviously this is still very, very young, but for a female reproduction, this is a turning point, because the chance of pregnancy starts decreasing after that. Consult with a reproductive endocrinologist, not
like yourself.
Like myself, not a gynecologist. A reproductive endocrinologist is a gynecologist, but has special training and certification in the treatment of infertility.
And are there other procedures in addition to IVF if someone's looking for another option?
There are many, many options available. There's in vitro fertilization. There is something called GIFT, gamete intrafallopian tube transfer, which is very successful in treating unexplained infertility, for example. So there's many, many options available.
Thank you, Dr. Shaykh. We appreciate you being here, and we also would like to thank the Assisted Fertility Program for sponsoring this segment.
For more information, you can go to their website, assistedfertility.org, or you can call toll-free at 800-777-4831, or locally at 398-1473.